According to health officials, a measles outbreak detected in Woodford County last week has now spread to Fayette County.
As Allie Root reports, families in central Kentucky are worried. They're concerned about potential exposure as cases of this highly contagious disease continue to rise.
There are currently 5 confirmed measles cases in Kentucky. 4 are connected in Woodford and Fayette counties. A 5th in Todd County appears unrelated. The disease is very contagious and spreads through the air. Public health officials have confirmed at least one place of exposure on June 20th at the Riney B Aquatic Center in Nicholasville, a place known to host hundreds of people at a time. Dakota Barr was there with his daughter that day.
It's really scary to think about the babies that may have been there who were too young to receive a measles vaccine, or immunocompromised children who may not be able to receive vaccines. They rely on all of us to protect them.
Barr says he is thankful his daughter is vaccinated. Doctors say the measles can be dangerous and even deadly for the unvaccinated in certain age groups, such as newborns.
We've already seen 2 children die this year, confirmed deaths so far, with other deaths suspected across the country. And we hadn't seen those in over a decade.
Health officials say this is happening amid the largest outbreak of measles in the United States since the disease was declared eliminated in the U.S. in 2000. Dr. Ryan Stanton says vaccine hesitancy is fueling the comeback of this preventable disease. He noted people against vaccines often point to rare risks of side effects.
Everybody has access to anything and everything that confirms the belief that they have. And unfortunately, some of those beliefs and some of those things are very wrong and potentially dangerous, and most of them are not based on science or facts.
Health experts say 2 doses of the measles, mumps, and rubella vaccine is 97% effective against the measles, yet only about 87% of Kentucky kindergartners are fully vaccinated, which is below the national average. Barr says he understands the concerns parents have, but that he always turns to trusted doctors for advice when it comes to protecting his child from disease.
You take them to their pediatrician, you take them to the doctor, you pick up their medication at the pharmacy, because these are the professionals we know and trust. And so I think those are the professionals that we should, ask for advice on whether or not to vaccinate our children.
Dr. Stanton says the more people are protected against the disease, the less likely it is to spread.
By us getting the vaccine and making sure that we are all vaccinated, we protect those who would normally get it that can't protect themselves.
In Lexington, Allie Root, Fox 56 News.
Anyone who was present at the Riney B Aquatic Center in Nicholasville on June 20th from 2 to 7 p.m. may have been exposed and is urged to keep an eye out for symptoms for measles for 7 to 21 days after exposure. Symptoms may include fever, cough, runny nose, red eyes, and a rash.